I'm your host, Jennifer Pulapaka with Podiatry Doc Talk. Regain your health with quick and ingenious tips and chats so you can be stronger and healthier. I'm here, making complex foot and ankle problems sensible and simple. Episode 9, The Big Four. Equinus Haglund's deformity, Achilles tendonitis with bursitis, and Retro-Calcaneal heel spurs. A patient comes into my office reporting pain at the back of the heel, not on the bottom of the foot. They may tell me that they've had a lump and it's been painful to touch. They can't wear shoes with a back on them, or they can't rest their heels on their lazy boy chair. Usually they report the problem has been going on for weeks to months, but they've been ignoring it. These can be all part of the Big Four. Before I talk about the treatments, I want to discuss 4 conditions. Equinus is a condition in which a patient has a limitation of dorsiflexion at the ankle, or when your legs are extended on a flat surface, you can't pull your foot back at the ankle joint because it's too tight. That's someone with Equinus, that lack of flexibility to dorsiflex your ankle. Now, Equinus can occur in one or both feet, and when it's involving both feet, usually one foot is worse than the other. People with Equinus develop ways to compensate for their limited ankle motion, but these often lead to other foot, leg, and back problems. The most common method for compensation is flattening of the arch or picking up the heel early when you're walking. That will place increased pressure on the ball of the foot. Other patients may compensate with toe walking, and some may take abnormal steps where you're bending the hip or the knee. There are several possible causes for this limited range of ankle motion. The most common one is due to tightness of the Achilles tendon or the calf muscles. And the calf muscles consist of 2 different muscles, the soleus and the gastrocnemius. In some patients, this tightness is congenital or present at birth, and sometimes it's an inherited trait. Other patients acquire the tightness over time, possibly from being in a cast, on crutches, frequently wearing high-heeled shoes or cowboy boots. In addition, diabetes can affect the fibers of the Achilles tendon and cause tightness or the inability of the tendon fibers to stretch. We've been talking mostly about soft tissue, but Equinus can be related to a bony blockage around the ankle. For example, a broken ankle fragment from an injury or a bony deformity. Equinus may also result when one leg is shorter than the other. Less often, Equinus is caused by spasms in the calf muscles. When we have spasms like this, they usually signal an underlying neurological disorder. Now, Equinus is related to a long list of foot problems: ankle pain, plantar fasciitis, posterior tibial tendonitis, calf cramping, Achilles tendonitis, Haglund deformity, Retro-Calcaneal heel spur, metatarsalgia, the pain on the ball of the foot, pressure or sores on the ball of the foot, flat foot, arthritis in the midfoot, bunions, hammer toes, and shin splints. I want to talk about 4 associated problems though: Equinus, Haglund's deformity, insertional Achilles tendonitis with bursitis, and Retro-Calcaneal heel spurs. Haglund's deformity is a bony enlargement at the back of the calcaneus or heel bone. There is a soft tissue bursa surrounding the insertion of the Achilles tendon, and it becomes irritated when the bony enlargement rubs up against something like shoes. This often leads to painful bursitis. Long-term Equinus and irritation at the insertion of the Achilles tendon lead to small bone spurs which form at the back of the heel and have involvement with the Achilles tendon itself. 2 common complications that result in pain. One is acquired complication, or the acquired component. This is when the rigid back of a pump style or a dress shoe cause bursitis, aggravating that enlargement at the back of your heel, and this occurs during walking, jogging, and exercise. The other component is congenital. The conformation of your foot structure makes you prone to a Haglund's deformity, Achilles tendonitis with bursitis, and the retrocalcaneal bone spurs. Now that you understand a little bit more about these 4 problems, the diagnosis is simple. 1. I evaluate the patient's symptoms. 2. I examine the foot, ankle, and leg muscles along with the tendons. 3. I identify the key locations of pain. 4. Sometimes I need to order x-rays to evaluate the structure of the heel bone and any retro-calcaneal spurring. 5. And possibly I need an MRI or a CT. I commonly use those when the treatment plan escalates. Now let's talk about non-surgical treatment. The aim is to reduce the inflammation of the bursa. While these approaches will resolve the pain, it will not shrink the bony protrusion. Some of these treatments include medication, both oral steroids and non-steroidal anti-inflammatories, ice packs to reduce the swelling, stretching exercise to relieve the tension from the Achilles tendon or the Equinus, heel lifts. Patients with high arches or who frequently use high heels or boots may find that a heel lift placed inside their shoe can decrease the pressure at that insertion point of the Achilles tendon. Now this should only be a temporary fix, and it should be used in combination with stretching. Shoe modifications such as a backless or soft back shoe to avoid or minimize the irritation, along with orthotics, can benefit. I like physical therapy with the use of ultrasound TENS and iontophoresis. Iontophoresis is the use of ultrasound with a topical steroid. Finally, we may have to deal with immobilization, in which a patient is wearing a cast or a cam walker with or without crutches. When non-surgical treatments fail, or they don't provide adequate pain relief, surgery may be needed. Therefore, be quick. Make your appointment when the first signs start to show of heel pain. Start a game plan quickly and stick with it. Know your limits and know when to follow up so you can be on your path to recovery.